But then, I scheduled your all-day event for tomorrow.
Howdy y'all, hope you guys are having a great Tuesday. So today we're going to talk about reflux, all about reflux. I have a lot of questions you guys gave me on acid reflux. We'll answer that and any live questions you guys may have on today's Poop Tip Tuesday. Guys, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Alright, so if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru trying to keep you happy and healthy from the top to the bottom. Every Tuesday, I go live on the social media channels to answer any questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. I'll put a link down below where you can get great tips and tricks to your inbox every single week. If you're new to these video series, every Tuesday I dive into a topic, answer any questions you guys may have. If you have a question for me, put it in the comments down below so I can see exactly what that question is, and I'll try and see if I can get to it as well. Let me know also, if you don't mind, if you're watching this live or on the replay and where you guys are watching this from. Hope you guys are having a great Tuesday. We have a lot of great questions I got on reflux. What exactly is acid reflux? What are the symptoms? What is the difference between acid reflux, heartburn, and GERD? And are there natural ways to treat your acid reflux? I hope you guys are doing great, and I'm ready to dive in. So let me know how many of you guys are suffering from acid reflux. I know reflux is such a common problem that a lot of people have, and so many individuals suffer from reflux symptoms. So what exactly is acid reflux, heartburn, and GERD? All right. So acid reflux is exactly what it sounds. It's when acid reflux up into the esophagus to cause burning and regurgitation to occur. Normally we have a sphincter called the lower esophageal sphincter that is closed usually whenever we're not eating and opens up immediately after we eat or whenever we burp or have things like that. The problem is that if that valve is open longer and more often, that is when acid reflux actually goes up into the esophagus. That is actually called acid reflux. So the root cause is not necessarily an acid problem, but it is that door being open longer and more often. So the best analogy I have is like a revolving door. Once you close that door, nothing will come up, but as soon as you open that door, things will flow in there. And if it's opened up too long and too often, that's when acid goes up. Now, the symptom of acid coming up can be what's called heartburn. That's the burning that you feel in your chest. Now, it's thought that a lot of people who have heartburn think that they're having a heart attack. It's very common because the pain is right here. But heartburn is a symptom from acid reflux. Now, over time, if you have chronic acid reflux going up into the esophagus, that's when you have GERD, gastroesophageal reflux disease. This is a chronic problem from acid going up from your stomach into your esophagus to cause those symptoms to occur. And that's the main difference. Heartburn is the symptom that you feel. Acid reflux is when acid actually goes up into the esophagus. And GERD is when that becomes a long-term problem or an issue over time. That's kind of the definition that we have when it comes to acid reflux. So what are the main symptoms of acid reflux? Let me know in the comments down below if you know what those symptoms are, because we have classic symptoms that are there, and then we have non-typical or non-classical symptoms when it comes to acid reflux. So let me know in the comments what you guys think. So the common symptoms of acid reflux includes burning, like heartburn, and regurgitation of food. These two things are the classic symptoms when it comes to acid reflux. But the issue with reflux is that it can cause a lot of different symptoms that are there as well, including asthma, maybe ear infections, maybe nasal allergies, voice changes. Sometimes as well, it can cause some issues inside the lungs. Maybe you can aspirate it as well. Sometimes you can have some nasal congestion, some upper GI issues, and there are a lot of different symptoms that can be due to acid reflux. Even chest pain, when it feels like you're actually having a heart attack, that can actually be due to acid reflux as well. And sometimes it's hard for us to differentiate between what those typical symptoms are, like burning and regurgitation, versus those symptoms that are not typical, such as asthma or allergic reactions or lung problems or things like that. So that's question number 2. All right. So Dr. Islam, question number 3. So Dr. Islam, if acid reflux is an issue that you're having, what are some ways that we can treat this? Now there's 4 main ways that I recommend when it comes to help treating acid reflux. Number 1, medical therapy does work. And for some individuals, we sometimes give them antacids, which is a short-term relief to help control some of the intermittent symptoms if you have acid reflux. So for example, you have intermittent acid reflux, or you have reflux only if you eat spicy foods. Sometimes you can take an antacid right before to help out with that. Number 2 is that sometimes we use a medication called an H2 antagonist. These are things like Tagamet, or in the past, Zantac. These are things that are also over the counter, and they're used for a little bit longer duration than antacids. Then lastly, we have the proton pump inhibitors, which are the ones that you may have seen on the internet, in which they actually suppress the acid by decreasing the acid cells that are producing the acid. By doing that, you can minimize acid reflux. But not everyone who has acid reflux needs to be on medications. And I'm the type of doctor that I want to try and see if we can get you off medications as much as we can. And sometimes the lifestyle changes can be a tremendous benefit when it comes to improving acid reflux. And sometimes some simple things can be done to minimize the need for you to be on medications, such as avoiding late night meals, avoiding some of the foods that can trigger acid reflux, like spicy foods, chocolate foods, caffeine, the things we sometimes enjoy. Sometimes having heavy meals can be that. Sometimes having meals and then lying down very quickly can cause acid reflux to occur. Sometimes also if you smoke, that can make acid reflux symptoms to occur as well. And if that doesn't work, sometimes we can also use more natural therapy. There are therapies out there like licorice that can actually help out with acid reflux. Sometimes Gaviscon is also a natural remedy that we use to help out with acid reflux as well. And for those individuals that do not benefit out completely from medical therapy, lifestyle changes, or even natural therapy, there is the option that we can also do surgical therapy as well. And in the right patient, this works effectively. And it really does help out when it comes to acid reflux symptoms, because a lot of our patients start to feel so much better whenever they do this in the right individual. That's kind of my spiel, though, when it comes to acid reflux. These are the most common questions I got when it comes to that as well. So let's answer some questions. So LaShonda asks, I have IBS-C and I go daily, but I was told I have moderately retained stool. I'm a little bloated and gassy in the mornings. Is this normal? What can I do to make sure my stools are not very hard? So yes, it actually is very, very common. Whenever you have IBS-C, constipation predominant, that means you have problems going to the restroom. And that very commonly, even if you go to the restroom every single day, the amount of stool or the frequency of going to the restroom is not important for me. It's how you feel. So if you go every single day and you're still not feeling like you're emptying everything out, it doesn't matter to me, because that means you are not having a good bowel habit. So there are a couple things to do. I'm going to do a post on this later on this week, but there's 2 main things that we worry about. Number 1, is your stool soft enough? And number 2, is your stool formed enough? And there's 2 ways that I would recommend naturally to help out with this. Number 1, magnesium is a very effective supplement to keep your stool soft so it's not hard, but also adding fiber to your diet is a very effective supplement, or a very effective option to keep your stools formed to allow you to have a good bowel movement. Our optimal bowel movement is a sausage-shaped poop. That's what we want. Now, I know eating sausages are not good for your health. I'm not advocating that, but I am advocating for a sausage-shaped poop. SSP, that's what I'm calling it. That's what I want, and that's exactly what I want you to have when you have a bowel movement. When you have that sausage-shaped poop, by adding magnesium or some fiber, that can help out. And if that doesn't work, we have other therapies that help you use the restroom. Very great question. All right. So Nini M asks, what causes H. pylori? And can H. pylori make you get gastritis? A great question. So H. pylori is a chronic bacterial infection that very commonly we get exposed to whenever we're young. And for some individuals, it doesn't cause any issues whatsoever, not a problem. But there are other people which it can cause inflammation or gastritis, which is inflammation inside that stomach. Now, there are other ways you can get H. pylori. You can get it sometimes from other people, ingesting H. pylori by either having bad foods or being in an environment that is not very clean. But the vast majority of people get it whenever they're young. There seems to be some sort of trigger that causes it to be active, cause inflammation, and cause gastritis. And over time, that can cause pain and discomfort in your upper abdomen. For some people, it can lead to inflammation of your stomach, causing other issues as well. For others, it can lead to ulcers in the stomach or even cancer of the stomach or lymphoma of the stomach. So for most individuals who have H. pylori, that's either causing symptoms or we see something on endoscopy, we typically want to give you therapies to treat that and usually do some sort of testing to confirm that the H. pylori is gone. Great question. All right, Vicky, good question. Does a hiatal hernia cause shortness of breath? It can if it's large enough. Now, it really just depends on how big that hernia is. Small hernias, not a big deal. But if you have a large hernia, part of that hernia is going above where it should be into the lung space. And obviously, if you only have a limited space up here and you have a very large hernia that's there, that's going to compress on those lungs and make it more difficult for you to have a deep breath and make it more difficult to do, breathing, make it more difficult to breathe, leading to lung issues. So yes, it can cause shortness of breath, especially if it is a large hiatal hernia. All right. So Gracie the Dawn, good question. You wake up every morning with nausea. Is that acid that collects overnight? So it's a good question, and it's hard to say. And nausea is one of those symptoms that are so difficult for us as physicians to know what the true cause is, because literally there are about 100 different causes, and not everything can be due to something going on in the GI tract. So yes, it can be due to acid reflux, and very commonly, one of the first things I recommend is to put you on a reflux medication to see how you clinically do with that. In some individuals, it'll help out with their nausea, and that gives me an answer that yes, your nausea is related to acid, and as long as we control that acid, it should control that nausea. But the important thing is that we have to give you a trial of a medication. If you take it for a couple of days, it's not going to give me enough evidence to say that yes or no, this is going to be the best option for you. We typically recommend 4 to 6 weeks, maybe even 2 months of therapy before we can say this is a treatment failure. It's very important for me to know this because otherwise I can't help you and I can't figure out exactly what else we can do to get you taken care of. Good question. All right. So Majori and Jimenez, good question. So you're asking if your sciatica can cause fecal incontinence. It's a very good question. And I will tell you, it's hard to say sometimes because, you know, your nerve that helps to innervate the sciatic nerve sometimes can have branches that go into the rectum as well. And if that's impaired or not working correctly, it has the potential to cause bowel issues. Now, everyone's so different. Not everyone who has sciatica has fecal incontinence. Not everyone who has fecal incontinence have sciatica. But certainly if there's a nerve problem involved, there is absolutely a possibility that that can also cause bowel issues to occur as well. Great question. All right. Walker Tahir, should I drink warm water every morning? You can if you want. I have no opinion. Go ahead if it makes you crazy. No problem at all. All right. All right, so Kimberly Drago, great question. Can you discuss gastroparesis on a future live? You've been diagnosed with gastritis and been recently diagnosed with gastroparesis. Wondering if there's a connection. Thanks. Well, Kimberly, what better time than now? Let's do it now. All right. So gastroparesis, let me know in the comments if you've heard about gastroparesis or if you know what this is, or if you know of somebody who suffered from gastroparesis. I would love to hear what you guys have to say about this if you've had this or you know somebody who has. And if you do know somebody who has, don't forget to share this video. So gastroparesis is delayed emptying of the stomach, meaning your stomach doesn't want to work correctly and things just stay in the stomach and does not want to move. Now, the two main causes, one is diabetes, but the other main cause, which is actually the most common cause, is idiopathic. We don't know. Some individuals develop gastroparesis for unknown reasons. We're not quite sure why. And some people, unfortunately, have other reasons, especially medical reasons, to have gastroparesis. Another common cause are medications that you use that can cause gastroparesis. The most notorious one are pain medications. So things like opiates tend to slow down the gut and make it more difficult for things to move through. Now, there are two ways that we use to help diagnose somebody with gastroparesis. Number one is that we have to do an upper endoscopy or an EGD. Now, when we do this procedure, we have to make sure there's no obvious mechanical reason why things are delayed. So we check for things like ulcers, inflammations, narrowings inside the GI tract to explain or possibly explain why you may have gastroparesis. If that is normal, the gold standard is a 4-hour gastric emptying test. Now, it's very important that it's 4 hours because any other test less than 4 hours is not accurate and will not diagnose somebody with gastroparesis. So in essence, what you do is you eat some eggs, we have you see your radiologist, and they take pictures, and we see how long it takes for food to leave the stomach after 4 hours. And in most individuals, almost all the food will be leaving the stomach after 4 hours. Now, let's say you've been diagnosed with gastroparesis. There are a couple different options that we can do depending on how bad it is, and we can use the gastric emptying study as a marker to see objectively how bad your gastroparesis is. For some individuals, dietary changes can help out. Small, frequent meals, grazing throughout the day, low fat, low fiber. Usually I'll get the help of a dietitian to help out. There are medical therapies that we could recommend. They work okay. Sometimes it's a hit or miss in terms of whether they help out. And for some individuals, sometimes a endoscopic surgical option can be a treatment as well. That's my kind of gastroparesis in a nutshell. Let me know in the comments if you know somebody who has gastroparesis or you know somebody who actually has had other treatments for this and what their response was for that. All right, perfect. So Mohammed Zahid, any relationship between upper epigastric pain and lower left back pain? Not that I'm aware of, unless there's something going on, but not that I'm aware of. So guys, one more thing too. If you haven't already, don't forget to let me know if you're watching this live or on the replay. And also let me know where you're watching this at. I would love to hear where my audience is watching these videos at as well. All right. All right, I'm just going through some more comments here. All right, perfect. All right, guys, I think these are all the questions. So if you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you get great tips and tricks so you can learn exactly what's going on inside your GI tract. Hope you guys have a happy and healthy day. And don't forget, let's talk about poop, guys. Thanks, everyone. Take care.